conversation. All right. Ladies and gentlemen, welcome. We are at 51 minutes past 8 a.m. and I've talked about this conversation for a bit because it is as interesting as it is intriguing and worrying at the same time. But I am not alone in studio. I'm joined by two brilliant gentlemen that are going to be helping me disseminate the state of teenage pregnancies in this country as of now. So I just want them to say hello and we jump right into the conversation because we definitely have a lot to talk about. Let's start with Robert. Just say hello. This is your camera.
Okay. Good morning, everybody.
Good morning.
My name is Robert Waweru.
Yes, Robert.
I work with the Kenya Human Rights Commission.
Yes.
As a program advisor for including other things, sexual and reproductive health and rights.
Yes. All right. It's a pleasure to have you here. Most welcome. Doc.
Yeah, good morning.
Good morning.
My name is Muiruri Joseph. I'm a medical doctor by profession. I work at Thika level 5.
Yes.
Thank you so much for having me.
You are most welcome. Question, general doctor or any specific?
At the moment, I'm a general doctor.
You're a general doctor.
General practitioner.
Yes, general practitioner.
Right.
We are happy. We are happy to have you here. It's an honor and a pleasure. I think let's start from the top, from Robert. And I want to know, as a programs advisor, what is your JD at KHRC?
Yeah, so my
what does your work involve?
Yeah, it entails advocating for human rights, all aspects of human rights.
Yes.
But specifically with regard to sexual reproductive health and rights, is calling for those people who are charged with the mandate of making sure that teenage girls do not get pregnant and they are failed, and that's why we came in with the red card campaign.
Yes.
And when you look at the red card campaign, we red carded 20 governors.
Yes.
And the CS for health. The reason for that is that we looked at the statistics, and the statistics that we used are from the KDHS, the Kenya Demographic and Health Survey that was released by the National Bureau of Statistics last year. So we had two categories of governors that we red carded. So the first category, we looked at the counties that have the highest numbers in terms of teenage pregnancies. And here we had like Nairobi, Kakamega, and Bungoma. So we had 10. And then we also looked at the counties that had the highest percentages. So because when you look at the statistics, you find that their counties, mostly like small marginalized counties, they have very high percentages. Like, for example, Samburu was leading at 50%. But when you look at their numbers, it's not a lot.
Yes, because the community itself is not huge.
Yes, it's not huge. So we decided to go with those two categories. So counties the 10 counties that led in terms of absolute numbers. And then the 10 counties that had the highest percentages.
Yes.
This is when you look at the vis-a-vis their population. So the reason why we went with those governors is because, as you know, the provision of health services is a default function.
Yes.
So it's up to county governors to make sure that they are put in place systems and mechanisms to prevent these teenage pregnancies.
Yes.
But also health policy is a function of national government.
It's a function of the national government.
So it's a shared function.
Yes.
It's shared between the national government and the county. So the national government is in charge of developing policy.
Yes.
And then now the counties are in charge of implementation
of the policies.
Yes. So both levels of government have actually failed us, and that's why you see the very big statistics of the teenage pregnancies that we continue to see each new day.
Exactly.
Yes.
So both we are coming from a point of where both the policy makers and the policy implementers have failed. Yes. Okay, let's talk to Doc Kidogo, but I want to come back to that. But Doc, on a week of you just being a general doctor, how many of these cases do you encounter? Let's say a month. Let's give you a month because I believe weeks are different.
Yeah.
But yes, in a month, how many cases and do you think they are worth of some attention?
I think from my experience, I wouldn't be very specific in terms of how many cases per week or per month. But they're quite frequent. You might get maybe like you might get 3 cases in a month. That's for where I work from, like Thika level 5. You might get 1, you might get 5, but generally when you look at the records, you realize the numbers are actually high.
Exactly.
So I wouldn't give a specific number because we don't have that specific data for the specific hospitals like where I work from. But personally, from my experience, we would end more than 1 week kama hujaona one or 2 cases of teenage pregnancies.
So, paint me a picture. What do these cases look like? Are they confused girls? Like, paint me a picture. Is it someone who knows what they want to do in the first place, or they come confused in the hospital, they don't know what to do, so you're left to sort of deal with the situation?
So usually most of them, how they present, they'll say I'm married. They come with someone like an older person. They will report to have been married. You get, but then upon further inquiry, when now the partner is not around, you actually realize they're not married. It was just to cover up the whole process. So you meet someone who is under duress, under stress, and the nature of pregnancy is quite intensive, both physiologically and also to the mental health, financially, socially. And number 2, in terms of psychological support and clinical support, when you compare the support that teenage pregnancies get, teenage pregnant women get, compared to the older women, it's totally different. So you'll meet someone who is stigmatized. First of all, everyone around you is judging you because you're pregnant.
Exactly. So do you think that is why they lie in the first place?
So they tend to lie. They say, I'm actually is my partner. But then upon further inquiry and try to create that conducive environment for them, you actually realize they're not partners.
Exactly. That they were just a cover-up. Ooh, so from a point of at a hospital, if these girls, because we also realize that not many of the girls actually get to go to hospitals, legit hospitals, but from where you're standing, from these girls that actually find the courage somehow, even if it is amidst lies, to come to the hospital. How do you think we can better that state, that environment for them? That if someone is courageous enough to get to Thika level 5, how can we better the environment for them and just make sure that they are taken care of?
I think it needs intentional surveillance. In terms of antenatal surveillance, perinatal and postnatal surveillance. Because like I've said, these people are under so much duress. So we have that responsibility to create a conducive environment for them. So what we need is just an informed workforce who are intentional about the nature of care that they're going to give. Remember, most teenagers, when they get pregnant, they don't always go to hospital. Actually, globally, half of the teenage pregnancies always end up in unsafe abortions. So by the time they're gathering the courage to come to a hospital setup, then you can almost tell they've already made that courageous step. So then it's our responsibility as healthcare workers to give them the necessary support they deserve. It's a very difficult period usually, because even the nature of their pregnancy, most of them don't always end up giving birth in the normal way. They always end up doing cesarean sections because they're not mature enough. The bones are not mature enough for them to push the baby. You get? So it's a difficult process for them, and they need a lot of psychological support.
So I'm getting proactive surveillance from all the stages, from the pre to the post pregnancy. That whole process needs a lot of vigilantes, for lack of a better word. Vigilance, a lot of vigilance just throughout the process, including postpartum contraception, because some of them they always end up coming back with the second pregnancy. So you have to it's a wholesome approach. So wait, why is that specific tendency of that? If someone has a teenage pregnancy, there is quite a chance that they are going to have a second baby not very far away from their first baby.
I think it's because we're not addressing the root cause of the teenage pregnancies. We need to go back to the drawing board and understand why are we having these increasing numbers of teenage pregnancies.
To start
so that we address the issues from the root cause. Most teenagers don't have information about birth control, about contraception. They don't have that information. Most of them are stigmatized. They cannot access reproductive health services. So they end up repeating the same mistakes over and over again.
So then let's get back to Robert and ask that very question.
Yeah.
What is the root of these issues? Like, what is causing this whole crisis? I know there are a number of factors, but take us through, because I know when you were taking through your numbers and your percentages, there had to be some common factors. Like, why is this, the underlying common factors? What is causing these high numbers of teenage pregnancy?
Yeah, so as you rightly said, there are a number of factors that that contribute to this crisis that we see it. One of the biggest causes is, of course, as Doc has said, is lack of information, because a lot of these teenage pregnancies can actually be prevented if people if teenagers actually access the right sexual information, and this is basically comprehensive sexuality education.
Yes.
We know that this is something that is not taught in schools. There have been attempts to teach our young children about basic sexual information, but there has been push and pull, so it has not been implemented. So that's one of the biggest challenges that we see, because if only as a society we can be willing to be open about and teach our children about some of these issues, all these issues we can be able to deal with it.
Actually, avoid instead of.
Yes, we can avoid. Because it's something that is very avoidable.
Yes.
But of course, now there are other challenges. There are issues of poverty in most places.
Yes. Just before you go to the other challenges,
Yeah.
do you think part of the reason why we don't have enough information is because there is certain sort of stigma, even with parents, even with teachers? Like, do we have honest, straightforward conversations?
No, we don't, and that's why I'm saying it's a part of the problem, because also parents also have a role to play, because you realize that they also don't have these conversations with their children.
Yeah.
I mean, also this information is not being given in schools.
Yes.
So now these teenagers are actually just left to their own devices. Like they have to, you have to get this information from sources that are not very credible.
Yes.
I mean, just having a discussion with Doc, and he was telling me, like, you'll find that they're getting their information from social media, from TikTok and from Instagram, and not all information that is on TikTok or Instagram
is actually credible.
Is credible information. Yeah.
Yes.
So that's one of the biggest challenges. So one of the things that we're actually calling for is that we need to have comprehensive sexuality education in our schools.
Exactly.
Yes.
So is this part of what the Red Card Insurance was asking for, that these governors can actually be able to put in place systems where we have these conversations in schools, where we have this conversation in public places, public hospitals, and in any public areas, in any form of gathering that we can be able to get? Is this part, like, what is the Red Card Insurance asking the governors to do?
So basically the Red Card campaign is a call to accountability for people who are in public office, and specifically the governors, because they are in charge of providing healthcare services at those levels, from level 5 I think going down, right? So as the doctor has explained, I mean, when you go to these hospitals, you find that in as much as they want to access some of this information, they are not able to access because of a number of reasons.
Yes.
But of course, the governors are just one aspect of it. I mean, there are other policy makers and policy implementers who have also failed. And that's why we even called out, for example, somebody like Governor Lusaka.
Yes.
He had recently said that any teenage girl who gets pregnant, they should not be allowed to go back to school.
Yes.
Which is a violation of many rights, including the right to education.
Human rights. Just in general.
Yes, in general. So we are also calling, actually, we are even calling upon the Ministry of Education to make sure that they have put in place mechanisms to ensure that every child, every teenager who has gotten pregnant, they are able to resume their studies normally without any form of stigma or any form of discrimination, because that's also one of the things that is preventing these girls from going back to school And now when you don't go back to school,
chances of second pregnancies,
Yeah,
because
now
now even
yes,
in terms
yes,
of
yes.
your time.
yes,
Exactly. So do you think such comments, I want to go back to that comment before I go to Doc, such comments by governors in power is just pointing, to the greater issues that even them themselves might lack understanding around this whole conversation?
Exactly. I mean, it's showing where the problem is, because you can imagine this is somebody who is in charge of providing a whole county.
Yes.
And they can stand up and say such a thing.
Yes.
It shows probably lack of understanding of the problem. Because as I said, these are not discussions that are had. I mean, people don't talk about these things. So
Yes.
even the leaders themselves, in as much as we want to call them to account, they also need to take their time to acquaint themselves with some of these issues, because these are leadership issues.
Yeah.
I mean, when you're in a county where 500 teenage girls are getting pregnant every day,
Yeah.
it's actually a health crisis even in
Yes.
that county.
Yes.
Yeah, because the health infrastructure will be stretched.
Yes.
Because as doctors say, some of these girls will try to procure
Unsafe abortion.
of course, and they will go to the quacks first.
Yes.
And then when it's complicated, now they have developed complications, they now come to public
Yes.
hospitals.
Yes.
So it costs money to treat them.
Exactly.
So it's an issue of also looking at it from that perspective, not
Yes.
just looking at it, these are girls, they need then to go home and become mothers.
Yes.
Yes.
So this is also becoming a financial issue,
Yes.
which means sort of governors plus all of their governance, to senators, to MPs, to MCAs, they should be concerned, because if we are looking at the money consumption that teenage pregnancies is causing, it's also a big deal. Yes, so, and like we said, if you're in a position of power, it's sort of your job to acquaint yourself. I like that, the term that you've used there.
Yeah.
To acquaint yourself with the issues that are affecting your very people. Doc, I want you to take us through other factors that may cause, other factors that are leading to teenage pregnancies. Of course, apart from a lack of information, which I think that we have dealt with. But I think we can all agree that the lack of information is starting from the very top and trickling to the bottom.
Yeah, it's so sad.
Yes, and it is a sad state of
I once had
affairs.
another political individual make a comment in a
Yes.
public rally
Yeah.
that teenage girls are getting pregnant because of immorality in the society. And of course, you can imagine the stigma that is going around when a prominent person makes such a statement
Exactly.
on national television.
Yes.
So it becomes quite chaotic.
Yeah.
Another factor that is very important to talk about is poverty. I think he mentioned it.
Yes, he did.
People who come from low socioeconomic places are at a higher risk of getting teenage pregnancies.
Yes.
And for obvious reasons, girls have needs.
Yes.
And one of the needs are menstruation hygiene needs. It's not easy to get pads
Access to
randomly.
sanitary towels, yes.
Anywhere.
Yeah.
And although it's a work in progress, we haven't gotten to that point where these products are freely available to our teenagers.
Yes.
So because of poverty, they are at higher risk of being taken advantage of. So you see people are likely to engage in transactional sex.
Yes.
They're likely to be convinced by older men to engage in sexual activity.
Yes.
In exchange for money to be able to get some of these sanitary towels.
Yes.
And of course, when you're engaging in sexual contact with someone who is way older than you,
Yes.
you lose the autonomy to make decisions in terms of maybe it's contraceptives you want to use.
Exactly.
Or however you might think it would work for you becomes difficult for you because you lack that autonomy because of the power differences.
Exactly, because of the power differences.
So that's a very common.
Yeah.
Another common aspect in our country that I've noted is we still have child marriages around.
Yes.
People might not, especially marginalized counties.
Yes.
Child marriage is still, I think they call emancipated minors.
Yes.
The minors who are already married, they get married at a very young age.
Yes.
And of course, they still belong in this category because of the risk factors that we've talked about.
Exactly.
You
In
get,
this country, those counties have leaderships, have governors in place, have people who actually need to be part and parcel. You know, if there's anybody who's going to lead, who is supposed to be leading, you know, these campaigns and all these activities around, it's supposed to be the leadership from those marginalized communities. I heard someone say, of course, this one was not even on teenage pregnancies, but they were speaking on the bandits that are found again on those marginalized counties, and they were saying if you want to stop banditry in this country, the best way to do it is through education. Because we might be out here saying, why are people stealing each other's kettles and everything, but without information, without education, you can tell that you cannot bring understanding to that person without sort of bringing them into the light of information and education in general. So I think that plays the same, because a parent that is forcing their kid to get into a child marriage, there's already a very big issue there. There's a very big issue with the understanding. There's a very big issue with the way they perceive.
Exactly.
So I think we also need, especially governors from now, the higher percentage communities need to be held accountable.
Exactly, because of when you look at the statistics from the KDHS and even other statistics that have been collected.
Yes.
You will see the difference in the levels of education and the rate of teenage pregnancies.
Exactly.
Is very, very high with people with low education.
Yes.
Is very low with people with high education.
Yes.
So education is one of the factors that is contributing. But I think also to just add one point, we are talking about teenagers here who are between 10 to 19. So these are teenagers who cannot consent to any sexual
to begin with.
Yes, to begin with. So already in situations like the doctor has explained, where you find it's an older person with a child, this is rape actually.
Yes.
Because teenagers cannot legally consent to sex. So one of the biggest problems that we have also seen is that there's a lack of accountability here, because these teenagers are not able to access justice.
Yes.
You find that they are in places where there are child marriages.
Yes.
And the society or the communities in that region treat this as a normal occurrence.
Exactly.
While it's actually illegal and unconstitutional.
And a crime.
And is actually a crime. Those people, they need to be processed through the criminal justice system.
Yes.
But you still find that also because of our own culture, is that either they don't report these cases, and even in situations when they report, it doesn't this person is not for a number of reasons.
Yes.
Either they are told probably they don't have good evidence, or sometimes there's a lot of corruption in police, the police, or even in the judiciary. So these cases don't even proceed as it should be. But also we also have a problem in our community where they like solving these issues at the local level, in the kangaroo courts, without wanting to take these cases to go to court. So that's also cultural harmful cultural practices is also one of the leading factors in encouraging teenage pregnancy, especially in communities that still practice things like FGM, because they believe once you have done that, now you're a woman, you should be married.
Yes.
So these harmful cultural practices is also one of the leading causes
of teenage pregnancy, and it is a sad state of affairs, because to think that someone in political power, like Doc was saying, can say that this is immorality, but a scenario where a 14-year-old girl is with a 40-year-old man, that's a punishable crime. This is immorality that we can pick out and actually punish, instead of just making it look like a cloud that these people are immoral in this generation, like almost something that you cannot pinpoint to the exact problem, and I think this is where now red card campaign comes in. I want to ask something before I go to the repercussions, which I want Doc to handle. Apart from just pointing out governors, telling them they need to pull up their socks, they need to act upon it, what other activities are going on in the red card campaign?
Yeah, so this is just the first step.
Yes.
As I have said, we want to pursue this fully to the next level, including so the first phase we have started with the lack of access to information, and which is a major contributing factor. We also want to discuss lack of access to services and products. And lastly, we also want to discuss about lack of access to justice. Yes. And so we are starting with the people who should provide for the policy, and that's where we were and implementing the policy, and that's why we were started with the CS for health. As at the national government and the governors. And then we'll go to the next step, which will still target persons who are responsible for making sure that teenagers can access the services and the products. And also now the people are also working in the criminal justice system to make sure
so
that
a question on that, on the second point, making sure that services and products are available. For example, there was what was going on Twitter. So are you guys going to physically get these things running, ensure that products and services are available, or you're holding people that are in those capacities to be able to provide service?
No, we are holding the people who are in those capacities to be able to provide, because as a Kenya Human Rights Commission, we are a human rights organization. We advocate for human rights. We don't do service provisions or service delivery. So, but there are people who
you're in touch, exactly.
Yes, there are people who have the mandate and they have the resources to be able to do that, and because of one reason or the other,
they are
not being provided the way they should be provided. And it's also an issue of also our society, as Doctor has explained. So it's about creating the demand, so that
the people that are supposed to come in
to be able, because it's also, we have a problem of the people who are supposed to get these services, they are, because of various reasons like discrimination, stigma, they are not seeking those services. But also even the people on the supply side, there are also many challenges that are making these people to, especially the teenagers, to be afraid to go and seek these services.
Exactly.
So we want to deal with both ends, so that
both ends of the string, to make sure that the person that is supposed to seek help has been able to seek help, and the person supposed to provide the help has also. Because it is a wonder that in the year 2024, the one thing I've not understood is why we still do not have free sanitary towels. That is something that I have not yet understood, that there is no room in our billions worth of budget for free sanitary towels. That is honestly, in terms of services and products, that's something that I have not yet understood. And I hope that this campaign will sort of solve that issue, because it's been ongoing for far too long. I want Doc to talk to me on the repercussions health-wise of teenage pregnancies, because I know you have dealt with this firsthand. What are some of the repercussions that come with teenage pregnancies?
I think first of all, we must understand that a teenager is not biologically fully mature for pregnancy. So imagine,
a question would be, what is the range in terms of years? At what age is someone termed, fully developed? Yes.
Yeah, there's no specific age at say 18 years. But statistics, according to statistics, people who get pregnant below the age of 19 years old are more prone to getting complications of obstetrics complications compared to the age group between 20 to 24 and then 20 to 39, 20 to 49. The chances keep increasing, and then they start decreasing from 30 going up. So the tragedy is at the teenagehood, below 19 years old. So see, normally just a few weeks before onset of labor, the baby usually descends down the pelvis, the bones that ultimately converge around the birth canal. So the baby will descend down with the head facing down. All right. So that is before the onset of labor. All right. So in a mature adult woman, the pelvis is able to expand and open up the birth canal for the baby to come out.
Yes.
Now for teenagers,
Yes.
they're not well developed,
Yeah.
so they're not able to expand quite well.
Yeah.
The cervix cannot open, the entry to the birth canal cannot
Yes.
open adequately.
Yes.
You get, so that become most of the time they get what we call cephalopelvic disproportion. The head of the baby cannot fit through the outlet of the pelvis,
Yes.
so the baby can't come out.
Yes.
So they end up getting what we call poor progress of labor.
Yes.
Find that someone has been in labor for more than 20 hours.
Yes.
Just in labor, they cannot push the baby out.
Yes.
So that is why most of the time they always end up in
In
cesarean section or other forms of assisted delivery.
Yes.
So that is one in terms of consequence of
Yes, of
but
teenage
also they are at a higher risk because of their physiology. Most of the time they are higher risk of developing complications such as hypertension in pregnancy. It's quite high among teenage mothers. So they have their blood pressure shoot up. It's a common condition in pregnant women, but now for teenagers it's quite high because of their physiology, the nature of their body. It's quite high.
Yeah.
And high blood pressure has so many effects on the body, including the brain and the kidney.
Yes.
So they are at a higher, they stand at a higher risk of some of these complications. And when they give birth, they're also at a very high risk of getting what you call postpartum hemorrhage. They lose a lot of blood.
Yes.
So they end up getting into complications that results from acute loss of blood, and it's quite dire. If you don't manage promptly, the risk of it, one of the most common complications of pregnancy and that can lead to maternal mortality is postpartum hemorrhage.
Yes.
So you can imagine it's quite higher in teenage mothers, teenage pregnant mothers.
Yes.
So that is one of them. It's quite common. I've seen quite a number.
So which means also a great number of them would end up losing their lives.
Yeah, it's possible.
Process.
Yeah.
Yes.
Yeah. So although now something I would give credit to our system in terms of maternal mortality, we've really tried to reduce it. So when it comes to a management of acute complication, most of the hospitals are well equipped to manage.
Yes.
So we might not end up with getting a mortality or death, but the consequences are dire.
Exactly.
You
And
get-
also the chances in teenage pregnancies
It's quite
are also
higher.
higher.
Yes.
Which means it sort of also puts pressure on the medical expertise and the medical field in general.
Yeah, it's quite intense.
Exactly.
Actually, when you see a teenage mother, they're not just attended by one nurse.
Yes.
It's a lot because of the implications around it.
That are around
Yeah.
it.
Also, they tend to give birth to low birth weight baby.
Yes.
And their labor will come always prematurely, most of them.
Yeah.
So usually in a normal person, will get from 38 weeks to around 40 weeks. Hapo katikati they're likely to start labor. For them, you'll get 32, 34. It's called premature labor,
Yes.
preterm labor. You get, there are higher risk of that. So it's, unfortunately, they're predisposed to many health risks. Even during pregnancy, there's an issue of maternal nutrition. They don't get good nutrition, they tend to get anemia. So they tend to get malnourished.
Yes.
And all these have an impact on the baby.
Yes.
So when give birth to a baby, most of them will grow with cognitive dysfunction, physical dysfunction, emotional dysfunction.
Yeah.
So I would say in terms of maternal complications,
Yes.
they're at a higher risk.
They are at higher risk.
Yes.
And even the babies that are born are also born into high chances of risk.
Yes.
So it seems like this doesn't get any better. Like from the time of conception in a teenage pregnancy,
It doesn't.
The chances of that entire lifetime just being always at risk is higher.
And then don't
almost
forget,
Yes.
almost half of these teenagers will not go to hospital.
Yes.
They actually consider terminating pregnancy outside.
Yes.
So that is where even the mortality comes in, because they procure
Unsafe abortion.
yes, and then they come with now dire complications.
Exactly.
So it becomes even worse. There's a higher risk of getting mortalities from attempted termination of pregnancy.
Exactly.
You get,
Yes.
So that is just the health aspect. There's an aspect of education.
Yes.
There's a whole stigma in more, especially the marginalized community.
Yes, that's actually what I wanted to ask Robert.
Yes.
Because now, apart from the medical repercussions, there are social repercussions to teenage pregnancies.
Exactly, and actually, when you look at it from a human rights perspective, and when you look at our laws, especially when you look at our constitution, the number of human rights violations that that comes with a teenager becoming pregnant, are many. I mean, the first is right to life and dignity.
Yes.
As Doc has already explained, you will see the kind of challenges that they go through, and unfortunately there are some who might even either die, especially the ones that try to terminate the pregnancy,
yes,
using
unsafe methods.
Unsafe methods. So that's a violation to Article 43 of the Constitution, which talks about access to health. Yes. Highest attainable standard of health.
Yes.
Then there's also the right to equality and freedom from discrimination. I mean, there's a lot of discrimination when they become pregnant, as he has said, one of the leaders was saying.
Yes.
And then lastly, there is also the right to freedom and security of the person. And the reason why this violation arises is because, as I explained, teenagers cannot consent to any
sexual activities.
So most of the cases leading to teenage pregnancy are actually sexual and gender-based violence.
Yes.
So, which is also another big problem in our society. So basically, we are saying that as a society, we have failed our teenagers because you can see the kind of all these violations that they go through as a result of getting pregnant.
Yes.
And also parents are also not absolved here. The parents also have a responsibility, and when you look at the Constitution and also even the Children's Act, parents have a duty to provide safety and well-being of their children.
Yes.
So a lot of time you see also maybe parents have become too busy with trying to make a living to a point where they have almost neglected their children.
Yes.
So that you find that now such cases ensues.
Yeah, because even in such community experiences, you'd find that, for example, a teenager who has tried to secure an unsafe abortion, chances are their parents have no idea that this kid was pregnant, or even or even by the time they come to get a whiff of what was happening, it's already into the complications, which means that parents also have a role to play to check in. Yes, Doc, I don't know what would be your advice on that, and also talk to me about postpartum stress in teenage pregnancies.
Okay.
The awareness, like what are the chances that a mom will bring a teenage pregnant daughter to the hospital? Or a dad, yes.
Yeah. I'll give you an experience that I had.
Yes.
So I had, I think she was 17 years old.
Yeah.
Then I was working in a medical department, not the maternity department.
Yes.
So we got a 17-year-old girl.
Yeah.
She came with, she was swollen.
Yes.
Her entire body was swollen.
Yeah.
And she was vomiting, abdominal pain.
Yeah.
She came wearing a hoodie, a very big hoodie.
Yes.
So the mom believed the girl had malaria.
Yes.
So even from the outpatient, somehow she came to the medical ward because her pressure was high.
Yeah.
She was swollen. We thought it was maybe something to do with her kidneys.
Yes.
But also she had a history of travel from the western side, so there was a possibility for malaria also.
Yes.
But now when we examined the lady, she kept lying on the side with a big hoodie, so we couldn't understand.
Yeah.
But when examining, got a very big abdomen.
Yes.
The mother didn't know. Nobody knew about it.
Yeah.
But the lady was about 36, 37 weeks pregnant. So very big tummy.
Yeah.
But you couldn't tell. So these teenagers are quite interesting.
Yeah.
They can hide stuff from you. So the mom brought the baby to the hospital thinking it was malaria.
Yeah.
But it was actually a pregnancy. She was having what you call hypertension in pregnancy, preeclampsia.
Yeah.
It's a very common complication like I've talked about.
Yeah.
Very dire.
Yes.
So he had to change the diagnosis and take the baby to the maternity side.
Exactly.
But now the mom was going crazy.
Yes.
Because now mtoto akwaje pregnant. Of course it's a case, and you know how restrictive our families are when it comes to sexuality.
Yes.
So I've never seen, it's unlikely to find a parent that is voluntarily coming to bring up a pregnant teenager. Exactly. Most of the time, especially in public setup, they come with their partners.
Yes, sir.
From my experience, they
from
come with
your
their partners. Once in a while, you'll get parents who would have said they're quite progressive.
Yes.
And they have good intentions for their children.
Yes, sir.
But I've seen the interesting cases I've seen just come with their partners.
Exactly.
Then you notice later it's pregnant.
So a question to both of you. I want to understand where the disconnect is, because by the time a kid is 36 weeks pregnant, that's about how many months?
It's about that's almost term.
That's almost
about
term. That is
8, 9 months. Yeah.
Because I think I have had an interaction from I want to say a specific family where the kid was actually 7 months.
Yeah,
I am like, what is the problem? Is the kid too good at hiding it, or is the parent unaware? Or what up, especially I want to talk about the extreme cases, because that spectrum is big, because 0 to 12 weeks, you might not, the parents is also not a magician really, but for it to go to almost the end of the spectrum, this kid lives at home, this parent comes in, or at least in a week they are available. Where is that?
I think parents need to be more vigilant, especially in the modern society.
Yes.
Because and also try to be more to create a conducive environment to have constructive conversations with our children. By the time this girl is hiding pregnancy for all that time,
yes,
clearly tells something about their relationship with their parents.
Exactly.
So there's a gap. Parents need to accept reality that abstinence among teenagers is almost being washed out in this generation.
Exactly.
So they need to sit down and have constructive conversations.
Yes.
Because imagine if she attempted to terminate a 36 weeks pregnancy. Yes. That is very difficult.
Exactly.
Yeah.
That
it's
is
just by grace that we noted. Yeah.
Yes.
So it's actually a red flag. Rather, it's alarming that you have a baby who is 36 and they're hiding from you.
Exactly.
You should take it upon yourself as a parent to change.
Exactly. Because I am imagining in that specific scenario, if the mom is just finding out, definitely the environment around it, the psycho environment around it, the mom is to get in line to be able to provide the attention that this kid that is pregnant needs is almost impossible. So this definitely means there's going to be a lot of postpartum stress, which I wanted you to talk about before we start wrapping up. The rate of postpartum stress from teenage pregnancies, how is that looking like in terms of community experiences? Yes.
Unfortunately, we don't have well documented statistics about it.
Yes, especially coming from a medical point, because you may not exactly be able to follow up.
Yeah,
after.
but exactly.
Yes.
But I've had the privilege to interact with these community groups. Like around Thika, we have a few community groups that actually support teenage mothers, and so they kind of provide psychosocial support for them.
Yes.
The fact remains that they're at a higher risk of getting into postpartum depression, postpartum psychosis. So we've had incidences where a teenager would give birth, and then they abandon the babies, or they get serious mental illnesses such as postpartum psychosis and depression. It's quite common. So we have support groups for teenage mothers, and I think it's important that I don't know, maybe my colleague will talk more about it, but the ones that we have interacted with, I think they're doing a fantastic job in terms of the support network. Because it's really, really important considering the repercussions that we have from these people. Remember, the stress started not just from the pregnancy. And most of the time, the person responsible for the pregnancy is either an old person, it's either a case of sexual abuse,
or a fellow teen who has no idea what to do.
And then a background of poverty, maybe lack of education. So put all that, then combine with the biological stress that comes with pregnancy.
That is already.
And the stigma in the society. Maybe if she tried, she was in high school, now she has to stop school. So now she's at home. There's a lot of stress that comes with it. So therefore we need intentional support to these teenage mothers.
So I think, Robert, you can pick it up from there. What are we doing? Is there anything that is happening in the Red Card campaign that is sorting the social surrounding of teenage pregnancies, like Doc is trying to say, communities, people that can actually be able to talk to one another, because also I think isolation is part of the problem. Like every teenage pregnant kid thinks the end of the world is here. So are we having any plannings around that?
No. Okay, specifically with the Red Card campaign, no, because this is a call to for accountability.
Exactly, yes.
But we do have other projects and other programs where we try to support all kind of vulnerable or people in vulnerable situations.
Yes.
And my other colleagues also do that work where we work with teenage girls, we work with even widows, basically people who are marginalized and vulnerable in our society.
Yes.
So that's one, the first thing. Another thing that I also wanted to mention, when you're talking about the disconnect, I think the biggest disconnect we have is with the lack of information, because even sometimes you're also making the assumption that parents also have all the information that they need with regard to that, and sometimes it's not the case.
Yes.
You find that there are many myths and misconceptions that people in different communities rely on. But the biggest challenge basically is the lack of information, especially with the teenagers, because for me, I've had many stories that there are even teenagers who are saying that you cannot become pregnant when you have sex on the first time, or you cannot have sex, you cannot become pregnant when you get so there are all those kind of so the biggest challenge is lack of information, because if they have the correct information, then we will be able to prevent all these cases of teenage pregnancy. We will not even have to get to the point where we are now discussing about the management.
How to handle management.
If
we had handled the
what we need to focus on is on the information and the prevention.
Exactly.
Making sure that the rights of these girls are not violated, because by the time we are now talking about management, we are talking about
has already happened,
something that has already happened.
Exactly.
Yes. So for me, I would stress more on comprehensive sexuality education, especially in school, both in schools, but also parents also have to play a role at home.
Yes.
And then in terms of our leadership, they have to make sure that they provide the services and the products that they are in charge. They are in offices that are supposed to provide this, and also just calling to account for people who make some of these reckless statements with regard to, because it contributes to it's part of the problem, especially in instilling stigma.
Exactly.
Yes.
To the entire community in general.
Yes.
I like that you've already handled. You already started handling proposed interventions like information, because we are talking about the myths and we are like, wait, how could someone believe that? But it's because we are coming from a point of knowledge. Because how on earth would you think that if you had sex standing you would not get pregnant? We need to tear apart some of those myths. Yes, demystify some of those myths properly to parts, so that no teenager will be having such thoughts or such beliefs in their mind, or even mothers or even fathers in the community. Doc, what are some of the other proposed interventions for teenage pregnancies?
I think I would say we can't insist enough on information.
Yes.
Once we beat that, and when you talk of teenagers,
yes,
you have teenagers in KU. There are so many people here in tertiary institutions that are 18 years old, 19 years old.
Yeah.
And I learned from this institution, from the medical school.
Yeah.
And we still interact with people who were in second year and they didn't know how P2 works. They didn't know how contraception works.
Yeah.
So it's not just information, but how do you use this information? People know that contraceptives exist.
Yeah.
If you ask random people about contraceptives, they tell you quite a number.
Yes.
But the tragedy comes in where they don't know how to use them. They don't have the information on how to use them correctly.
Yes. Let me just cut you, because I had an experience that you to jump out of your skin.
Yeah.
I don't even know. I can't remember who we were having the conversation with, but some teenagers had an issue of weight gain and physical change. They're like, Mimi, contraception, no. I don't want to be fat, I don't want to be thin.
Yeah, it's true.
So even accessing the right information, because knowing the disadvantages and advantages of each and these contraceptives will help you even make an informed decision. That a teenager is very stigmatized from weight gain. Just imagine how they would handle a pregnancy, because it's going to happen if they are not going to use contraceptives. So you can already imagine the kind of people, the kind of information that is out on the streets.
Yeah, it's I think, and then when you talk about information, there's also something that comes along with it. It's information and products. So another way to sort it is, do we have access to contraceptive services? Do you have is an 18-year-old lady able to access contraceptives? Is a teenage mother able to access contraceptives? We need to have that conversation, because you are empowered with information as well as services. These are very important. They go hand in hand. You can't have one and lack the other. You have the product, you don't have information, you misuse it. Most teenagers are at a higher risk of stopping contraceptives because of the side effects. Like you said, I get into it, I don't want. It's actually statistically been proven that teenagers are at a higher risk of stopping contraception because of the side effects. They imagine it's too much for them to bear. So they stop. But as part of the solution also, because like my colleague has said, there's a lot of accountability that we need to put in place. We need to, there's a case, the youngest teenager in our country, 1986, she was 9 years old. She got pregnant from an older person. In 2015, there was a 10-year-old girl who got pregnant from a 60-year-old man who happened to be her guardian during childhood. So we need to have accountability. We need to strengthen our legal system so that we put these people, we make them accountable for their actions. And of course protect the children's right. So that is quite important. And of course we have to address the stigma, like my colleague said again. We have to demystify all the myths around it. So that we raise a community of teenagers that are well informed. So they're able to make informed decisions. Because now what we are doing, we are leaving them at the mercies of TikTok and Instagram, and that is tragic.
That is very, very tragic. I want us to prepare for closing remarks because we are out of time. You would wonder, we've had this conversation for about an hour. Gilo is saying, as a teenager, I'm learning a lot from this, and I would really love to advocate for this type of education to get my fellow teens out there. Akunda Ismail is saying, great conversation. There is also need to address peer pressure and the need of peer education in schools and in media, which we agree. Mugeni Nelly is saying, I love this topic. The girl child should be empowered, and also harmful cultural practices should be addressed and stopped. I think everyone is picking a thing from what we are having. The Mufasa is saying harmful practices should stop and get forums to address and make awareness. Loving the show. Thank you guys very much. So as you can hear, we are having contributions for this conversation. Debbie Rono is saying also sex education needs to be clearly put out there with no fear. We couldn't agree more. I just want us to have closing remarks, because this is a wide topic. This is a topic we could have over a whole year and still not finish. So closing remarks from Robert before we go to Doc and close.
So this is a crisis. When almost 700 girls are getting pregnant in one day, it's a big crisis, and we need to, all of us, put our hands and minds together. And everybody who has a responsibility towards these children, they must play their respective responsibilities. That starts at home with the parents, in schools, and also now those people who have the mandate, that they make sure that they do what is necessary for them to so that we can prevent this crisis from continuing.
That is true. So I don't think I could say it any better, really. Doc, closing remarks.
Teenage pregnancies is a global phenomenon. And at least 15% of our teenagers in this country have been pregnant before. 1% have attempted to terminate their pregnancies. So therefore it calls for joint responsibility at individual levels, the community level, the national level. It spans across. So we have a responsibility, a moral responsibility, to educate our teenagers so that they grow to be well-informed adults, and even during their teenagehood, so that to curb this issue of teenage pregnancies in our country.
Yes.
Yeah.
Exactly. Thank you, Doc. I think this is calling. Like I said, this conversation is going to affect you anyway, because whoever you are, a teenage girl somewhere. Another final question to you, Robert. How can the general public plug in into the Red Card campaign? How can they be able to plug in, and what activities are we expecting?
Yeah, so I think one of the ways that they can be able to plug in is for them, wherever they are, to call on the elected representatives, especially those ones who are mandated with making sure that our teenagers, are protected. They do that whether it's through social media, whether it's mainstream media. This campaign is on social media, is on Twitter, it's on mainstream, like what we are doing here. So they need to support. They need to ask their leaders, mostly, especially governors in counties, especially in counties where there are high rates of teenage pregnancies. They will need to hold to account perpetrators who perpetrate these cases, and they need to make sure that they are held accountable, as I said, because this is a very gross human rights violation that's happening to our young girls.
Yes.
Yeah, so that's how they can support the campaign.
That's how they can support. That means actually on the next election, if that is not part of the agenda that your governor, your senator, your MCA has on their list, there is something that says this is not the right person. Thank you gentlemen for being here. Thank you for helping me disseminate that conversation in a tight time but wholesomely. Thank you so very much. Let's go and all of us play our part, and thank you for visiting us. We hope to have you a bit more often so that we can disseminate some of these things from their root, hence being able actually to offer solutions, long-lasting solutions. Guys,
thank you for having
so much
us.
for staying tuned in, for having contributing to this conversation. We are almost wrapping up, so let's take a sweet quick short and sweet break, and then come back and actually close the show with our art calendar.